Welcome back to Thirani. This is Joe B. In this video, we'll be answering the question, how do we effectively use the single point cane during the subacute phase of a partial hip or knee replacement? Let's dive in. Elective joint replacement surgery can be a partial hip replacement or a hip hemiarthroplasty where only the head of the femur is replaced. Or it can be a partial knee replacement where only a medial or lateral compartment is replaced. Due to the minimally invasive nature of the procedure, the patient can ambulate with a least restrictive assistive device like a single point cane unless their balance and advancing age as well as multiple comorbidities suggest otherwise. In order to correctly adjust the height of a single point cane, you need to know its parts. The part where you grip is the hand grip, while the part that touches the floor is the rubber tip. Then you have the fixing clamp and the height adjustment button. To allow adjustment, you need to rotate the fixing clamp counterclockwise or lefty-loosey. Then press the height adjustment button either to move it towards the hand grip to shorten the cane or move it towards the rubber tip to lengthen the cane. After that, rotate the fixing clamp clockwise or righty-tighty. To adjust the cane, the patient stands hip-width apart and elbows extended. Single point cane is placed at the side of the midfoot. From this position, the cane needs to be shortened or lengthened such that it is at the level of the wrist when the elbows are extended. This will then result to a 20 to 25 degree elbow flexion when holding the cane. So you do not flex the trunk too far forward when advancing the cane. The cane is best held opposite the surgical side. After hip or knee surgery, the best way to walk with a cane during the subacute phase or 4 to 21 days after partial hip or knee replacement, especially with good coordination and balance, is using a 2-point gait since it is faster. This walking pattern are also preferred for community-dwelling elderly 65 and up without balance impairments. The patient advances the cane and the left surgical side extremity first, then the right side. This gait should be a step-through pattern, meaning the right foot should pass through the surgical side after the step. Then just keep repeating the process every step. When walking backward, the sequence will be the non-surgical lower extremity first, then the single point cane and the left lower extremity. When turning to the right, the turn should be in a 45-degree increments, leading with the cane and the left surgical side first, then the non-surgical side, which is the right side. When turning to the left, the turn should also be in a 45-degree increments, leading with the cane and the left surgical side first, then the non-surgical right side. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Thirani.